I want to go over now doing an Athena template for an insertional Achilles tendonitis. This was a young gentleman, a 17-year-old young man that came in. He's playing basketball, and you can see here it's been hurting for a couple of months. He's tried some icing and other things like that didn't work. And the review systems was basically normal. I just want to show how easy this is to do. Vascular was fine, skin was fine. He had some pain to the posterior insertion region of the Achilles. I just added that. It's really easy to add. You double click and add that. And then he did decide to do EPAT today, or shockwave, on that side. So that was the right. It was the heel. We have a ceramic and a gold tip. We use the ceramic tip. I started out a little bit lower for 500, and then I usually do between 2,000 and 2,500 up at a higher level. And these are all the settings. These are procedure codes. So all these codes are right here under all of, there's 98 of them. These are all the different procedures, and these are linked to the billing tab. So basically, if you do decide on Athena and you like these, just send me your email, and I can email Athena and give you access. Or if you want just them in general, I've put a link underneath here, and I can give them to you if you use a different EMR, just to make things easier. Then I did the X-ray review here. And then the X-ray didn't really show that much. They had an ospronium and ostrigonum and a big prominence there, a little bit bigger of a prominence. This pulls in automatically. I have some patient instructions under Achilles tendonitis on the website. And then this discussion note is one of those dot codes. So once again, if you do dot Achilles as the bulbous type, or quinolones, or just regular heel pain, and it pulls in this, and I deleted some things because basically he's going to rest ice. He did shockwave, deep tissue massage, and then a heel lift. And that's how you do the note here. He's going to return 1 week for EPAT. And then we do a letter to the doctor. And then the billing is pretty easy. So this is a new patient for Achilles tendonitis. We did x-rays of the foot, and then we did x-rays of the heel. All of these are added into our medical record beforehand. Okay. And then he did EPAT on one side, and that's not billed. So this is a billing tab. I take that off because it's not billed. He pays cash for that in the office. And then when you're done, you can just hit sign and close, and then we're done with that note. If you found this helpful and you want some more tips, there's some links underneath this video to learn more. Okay, hope you enjoy it. Thanks.